Well, former ACT politician Giulia Jones is on a mission to transform the way we approach women's health. The mother of 6 has just been diagnosed with breast cancer. That happened earlier this year. And ever since, she's been encouraging other women to get mammograms to detect the disease early. Today, in her capacity as Painaustralia CEO, Giulia is bringing awareness to chronic pain experienced by nearly 2 million women across our country in a bid to change the way the condition is diagnosed and treated. And Giulia joins me live from Parliament House in Canberra. Giulia, thanks so much for your time. I contacted you a couple of weeks ago when you had to shave all your hair off, and you're such an inspiration. I'm sure you're really tired between chemo treatment and looking after 6 children, so I appreciate your time. But you're obviously very
Laura,
passionate about this.
Absolutely. It's a full-on time of life, but you know, they say if you want to get something done, ask a busy woman.
That's right. We have been busy this morning, Giulia, and you now have lived experience of this. What needs to change?
Yeah, well, basically, one thing we know about chronic pain is it's very prevalent. It's about as prevalent as mental health problems. 1 in 5 Australians live with chronic pain. You wouldn't know it, but in every lunchroom, on every bus and in every cafe and in every family home is someone with chronic pain. It doesn't discriminate on age, and it's slightly geared towards women. More women than men have chronic pain. So today we're highlighting women living with chronic pain, chronic pelvic pain, chronic musculoskeletal pain, chronic nerve pain. This is pain that doesn't go away. So how do we manage it? We need to get multidisciplinary pain management going, which means physio, some tablets, really good GP care, and exercise, diet. All of those things need to be working together for the person in the best way possible. So we've put a big ask to government this morning from the lawns of Parliament House, seeking a change to how GPs deal with chronic pain.
Are you in chronic pain at the moment?
I have a pain condition in my lower spine from an injury from when I was younger, so I do know the experience of chronic pain. It's not as painful as some of the conditions that we're dealing with, but I know what it's like to not be able to get rid of your pain.
Yeah, what works, and is the government hearing your message today, do you think?
I believe they are. I've met with Jed Carney's office, the Assistant Health Minister, and I've met with Jed Carney herself and with Mark Butler's office. And I do believe we're going to get somewhere with this ask. Obviously, we've got a bit of negotiating to do. But what we're asking for is, at the moment, if you get a team care arrangement through your GP, you can get 5 allied health visits. We want 10, as well as the 10 mental health visits that you can get with a psychologist under a mental health plan. So if we can get people the multidisciplinary management they need through the GP, it's the focus that the government has at the moment on chronic pain and conditions is to go through your GP. We just need it to actually work for people, and 10 a year is a good start.
Yeah, absolutely. Well, thanks so much for raising this issue and being as persistent as always. It's a pleasure to have you on AM Agenda. And I love the do, I got to say. Do you like it?
Yes. This is my wig. I call her Loretta.
Well, at least you don't have to do your hair every morning.
No, it's actually a lot easier than normal hair, I can tell you. But, you know, I'm looking forward to getting my hair back one day.
I'm sure you are. And we joke, but you're so great. And I know that your positive outlook and your humour certainly gets you through. And I appreciate you sharing that with us today.
Yeah, there's so much we can do, each and every one of us, every day. Thank you, Laura.